So today I'm going to be talking about what surprised me from the materials this week, what didn't surprise me, three things that I learned about mental health disorders, three things that I learned about substance abuse disorders, and how I can implement it, what I learned in my career as a psychiatric nurse practitioner. So, what surprised me about this week materials was the content about depression being related to chemical imbalance. I recently read an article that was published in the Molecular Psychiatric Journal suggesting that depression is not likely caused by a chemical imbalance. And this was questioning what antidepressants like SSRIs do and how they work since they are designed to correct low serotonin levels. I thought the article was really interesting and it really kind of questions if what happens to people with depression and other mental health disorders are truly related to chemical imbalance in the brain. I thought it was really interesting. Um, what didn't surprise me was that so many disorders have a genetic component. Um, I think as from my own experience, I have a lot of family members in my family that experience depression, anxiety. There, a lot of them are suicidal at some point. So I honestly think that that should be somehow related. Three things that I learned about mental health disorders. I didn't realize that I think the panic disorder had a genetic factor. I thought the panic disorder was just thing that happens related to anxiety. I never thought it was related to panic disorders. I learned about the positive and negative symptoms of schizophrenia. I thought those were very interesting. Um, and I also learned that SSRIs have fewer vascular side effects than drugs that block norepinephrine compared to other drugs. I thought that was very interesting. I'm not going to read the whole thing. Um, three things I learned about substance abuse is about disulfiram. I think I heard about drug before, but I don't think I realized that it was this drug is taken on a daily basis and causes that kind of reactions if somebody drinks at least a sip of alcohol. I didn't realize that people can take tablets to treat opioid addiction. I always thought that was more like injections that was done in a clinic. I didn't realize that it's a new treatment, and I think it's very interesting. I didn't know what nitrous oxide was, and I learned that it's often used to get high, and I thought it was very interesting too. Um, I think what I learned during this week was everything very interesting and will help me eventually to provide better quality of care for my patients and to see them in a more holistic way. I feel like sometimes we are very clinically oriented and we kind of forget about the pieces that make that the patient um, has this kind of problems, including substance abuse. And I thought that everything was very interesting. Thank you.